Family therapy is really a commitment to the family. It's a commitment of change, and it's a commitment that demonstrates that family is willing to do the kinds of things necessary to shift. That kind of commitment is a complement to the hard work that the client is doing here every day at Skyland Trail. My focus with family therapy isn't to so much focus on the individual. It's a focus on what goes on between people. How do people talk about things? How do people not talk about things? What kinds of things get talked about, and what kinds of skills might help them talk about the things that are important to them. So family therapy is about what goes on between people, the patterns, and how to shift some of the things so that those patterns that are helpful can be developed. The kind of work that goes on in family therapy is integrated into a client's treatment here. As part of the treatment team, the kinds of concerns and the kinds of struggles that a client may be having is addressed in family therapy, but also gets communicated to the primary counselor so that the primary counselor, the individual counselor, can work with a client perhaps on some individual issues related to those that are going on in family therapy. The bottom line is we strive to integrate our whole treatment here, and as part of the treatment team that allows us to do that. In general, I encourage families to begin family therapy as soon as possible after their loved one has started here at Skyland. Addressing family therapy early allows them time to be able to address the issues that are of most importance to them. For some clients, there may be some symptoms or issues that need to be addressed before they're ready to participate in family therapy. And so there may need to be a delay after their family member begins here. It also may be likely that their family member may need to learn some skills to help them in a setting like family therapy. Family therapy is really focused on what's going on with the family at their stage, at their developmental stage. So having parents with young adults, the kinds of issues that they are dealing with might be very different from a family that is concerned about a sibling or a parent, or even a family that may be dealing with couple issues. One of the things that often comes up is this idea of independence and launching. How do young adults move from being a dependent into being an independent functioning adult? Many times parents have been in this mode of fix it, take care of it. And that's part of what it means to be a parent. That's been going on since they came into this world. That they are looking out for, do they have enough diapers? Do they have enough food? Do they have the right school? Do they have their books? Do they have their homework? What's going on with friends? When they get to be an adult, things start to shift. And it's really important that young adults get a chance to develop their own skills for running their life. And because of that, parents have to shift how they go about parenting their child. It goes from fixing, taking care of, reminding, to how to be an emotional support and emotional presence for their child. Family therapy for couples can look somewhat different than it does for a parent-child kind of scenario. Often for couples, it's a first time into something like family therapy or even couples therapy. And the focus is often on trying to help the partners work together to address first the mental illness and then to address their couple relationship. As a result, there is an education component, education component about the mental illness, and there's also an education component about being a couple. And what does that look like for a couple who may be struggling with some kind of issue like depression or bipolar disorder? So we look at different kinds of approaches for helping couples stay connected and in the kind of relationship that they would like. I think most families find that they begin to benefit from family therapy in ways that they may not have expected. And for most families, I would imagine, and in my experience, they look to continue family therapy following discharge. They have begun to see that having a place to talk about things in a structured kind of way, having a coach there to help them deal with some of the issues that come up, is something that they want to continue to benefit from even after discharge. Families, wherever they are in the world, can participate in family therapy. We have the technology to help families connect with us electronically, and we do many family therapy settings with video conferencing or audio conferencing through the telephone. We've had multiple members of families across many different time zones, all participating in family therapy at the same time. So we can accommodate a family's needs wherever they are in the world.